Shirley came in with a partial that she doesn't like. She had heard about a flexible partial that can be made that is seemingly more comfortable and doesn't have the unsightly clasp. And I think most people, if you talk to them, what they don't like about their partials, they don't like the way they look with the clasp. They don't like the way the partial feels because of the metal.
Exactly.
And then she has educated me on a few other things that I hadn't necessarily heard about. The taste of the metal. And that can be a problem when you're eating certain types of foods. But this is the partial that she has.
Yes.
And it's the metal with the teeth and the clasp. And it obviously is something that, you know, I mean, it's like a little spider.
Yes.
If I can use that term. So is your partial unsightly? You don't like the way it looks?
Yes, my partial is very unsightly. I don't like the way the rings look when I smile. It causes the teeth to wear down. It seems as though that the more you put it in, up and down, the teeth is grinding the teeth off. So the partial wears on the teeth, the metal does.
Yeah, and if it wears the teeth too much, they could actually need to be crowned.
Exactly.
Or you might lose a tooth because of that. And they can make teeth loose because they're putting a lot of force or pressure.
The pressure from the partial is really, it does. On the tissue, I feel like I can actually feel it. And again, like you said, when the pressure is also in my jaw, I can feel like it's always tightening up. The partial, every time I do that, put it in and out, it is a lot of pressure. You feel like my sinuses are always acting up, a lot of pressure here in the jaw.
The taste of the metal, when you put it in, you can actually taste that metal, especially when you eat certain foods. Tell me about that.
I can taste the metal, especially when I'm eating like spaghetti, pizza. That's when I really notice it. When I'm eating like foods with, like you say, a lot of acid in it or in it, that I can taste the metal. Yes.
That doesn't sound good to me at all.
And it isn't. Especially, I've noticed that a lot of other health issues in my mouth. It seems as though I feel as though now that maybe I'm wondering if my breath smells or anything, because sometimes it seems like the partial carries an odor sometimes, so I'm constantly trying to take it out to clean it or whatever, because it holds food.
Yeah, that's another thing that partials can do, is harbor bacteria. Tell me about the clasps and issues you've had with the clasps that hold the partial in place.
They actually will wear off. I've had to replace them twice, and you will notice from the ones that I do, the teeth will fall out also. Over time, the teeth fall off that metal really easily if I haven't replaced it. The clasps do break.
Lots of times partials are made and they become very expensive shelf ornaments. In other words, they're made, person wears them for a few days, few weeks, maybe even a few months. They get tired of them, they take them out, they figure, why do I even want to wear this thing? I can eat okay without them, but eating with them is even more of a chore.
Yes.
And that's not what they're designed for. We want people to be able to eat with partials. So what we have is we have an alternative. It's a flexible partial, which I think is a great option for people who have problems with the metal partials. And I don't want to say that the metal partials are no good. They certainly have a lot of great uses, and in certain circumstances they may need to be metal. But the alternative is the flexible partial, and everybody I've made a flexible partial for loves it, especially if they've had one of these old metal ones.
Yeah.
So I want to show her, and she hasn't seen it yet, but I want to show her what the flexible partial looks like. So this is the flexible partial, and I don't know if you've ever seen one of these.
I have not seen one.
But what I like about it is, first of all, it's flexible. It's all tooth and tissue color. So there's no metal clasp like like this other partial. This, literally, when you put it in your mouth, it disappears. And then the other thing that people like about it, or that I like about it, it's almost like it's got independent suspension. So when you chew on this side, the other side can flex. So you're chewing with independent suspension, whereas a metal partial is going to move up and down evenly on both sides, and it's going to wear out the teeth. And that's why the teeth wear so badly. This doesn't have the metal clasp, so it can glide across the teeth. And I won't say it can't wear the teeth, but it wears them at a much slower rate. It doesn't have the metal taste. It generally, because of that independent suspension, it's going to trap less food. It's lighter, so it's more comfortable. So I understand shoes, let me put it that way. Shoes can be very uncomfortable for me, but if they're light, they're always more comfortable. And they've come out with shoes that almost feel like you're You're floating.
Yeah.
That's kind of what this partial is. It's light and it literally, it doesn't float, but it feels like it's not there. And
Awesome.
patients really love this guy.
Awesome.
So.